when it comes to the Global P.A.D. Association, we have our Lifesaver hotline. And of the more than 1,000 tangible saves that we've had since inception in 2019, 35% of the patients that called our hotline at 833 PAD legs, 35% were told that their amputation was being performed due to diabetes. Not one had a diagnosis of PAD prior to finding our hotline. And can you guess the percentage of those patients that actually proved to have PAD?
Oh, it'd
100%.
be close to 100%. Yeah.
100%. Every single one of those patients proved to have PAD, even though doctors said that the amputation was due to diabetes. The infection that you have, it's due to just diabetes. Now, that being said, it's not to say that there aren't instances where the amputation is due to diabetes, because I have had those situations. We do have patients that have come to us where literally they have fantastic flow going through the main arteries, and then it is those smaller capillaries that end up having the issue, and they end up with an infection to the bone, osteomyelitis, and that spreads, and they do need an amputation due to the diabetes. But in my experience, those are few and far between. What about you?
Right. No, it's so many of the people, they show up with that diagnosis and they get an ABI. It's normal. And nobody gets the TBI to check the flow from the ankle to the toe. And now with the loop procedures and our big meetings in Nashville this week, and I was at dinner last night. I love the fact that so many of those guys are doing the loop. They're treating the distal arteries in the foot. And that's exciting because it just works. You've seen it, you know it. And the naysayers are the ones that have never done a loop, never treated the arteries in the feet. And so you go and you open up those arteries and you see how much relief they get. I'm astonished. I expect to come back and do, as we'll talk about later, so spinal cord stimulator, some kind of additional treatment. And I would say it's 10 to 20% that most of them get enough improvement. They're like, I'm fine. I'm not normal, but I'm so much better.